Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Nuha Hatem. I am Obstetric specialist at Masan Polyclinic. It's our pleasure today to present to you the subject about safe medication in a pregnancy in a primary health care. This is the first part, is about the GIT, common GIT symptom in a pregnancy and the safe medication that can be used in pregnant women. This work in collaboration with a pharmacist, Hamida Al-Ajmi, we work together on this subject in order to be sure that we are using the safe medication for the pregnant women. So as I say, we start this between me and between Hamida Al-Ajmi because it started that one day we were involved in the same patients and we were discussing what medication they should take. We found ourselves taking different opinion on certain medications. So after researching it together, we reached a common ground on what the patient should take. So this sparked our goal to research what is the safest medication for pregnant women. And we make it like system by system. We start by GIT because Ramadan is near. So, and most of the common symptom in pregnancy will be related to GIT problems. I hope this will help you and you can use it as a source when assessing a certain medication. So as you know, the medication can be divided according to their safety, either A, B, C, D, X. A and B can be used safely in pregnant women as there's no risk to the fetus. However, C and D and X is better to be avoided. So as I say here, this is work done by me and by pharmacist Hamida. So the medication that are available in primary health care is mentioned in the following 3 pages. The antacid, which is Moxil, considered as B, so can be used safely in pregnant women. This fork and spoon, which is made by pharmacist Hamida, that means it can be used before or after meal. And of course, the antacid is the first line for heartburn and acidity in pregnant women. What about antispasmodic? Either we have hyoscine and butyl bromide, which is known also as Buscopan. According to the category, it is P2, but according to the up-to-date, it's better to be avoided and not used in pregnant women. The same for midwiferine, which is used for irritable bowel syndrome. It is considered as C, and it's better to be avoided in a pregnant woman. However, if you want to know the timing of this medication, it can be used before meal. As you see here, minus can be used before meal. What about famotidine, ranitidine? These are the histamine H2 blocker, considered as group or category B, and can be safely used in pregnant women. And as you see here, minus means that can be used before meal. About omeprazole, which is a proton pump inhibitor, also is a group B, also can be used before meal. What about antidiarrheal drug? Ores, of course, can be considered as a group A, can be used after or before meal anytime. Loperamide, which is anti-motility, is the only safe medication for diarrhea in pregnancy and considered as a group B and used before meal. Regarding constipation, we have bulking forming laxative or stimulant laxative. Bulk forming laxative, which is Ispacola husk, which is the name, also known as name Fibogel. is the first medication for constipation in pregnancy and considered safe, and group B. Related to the meal before or after, Biscodiol can be used also in pregnancy, category B, but in third trimester, better to be used in caution. Has no teratogenic effect on the baby, but it might lead to contraction. However, it can be used in pregnancy. It's not contraindicated. And before meal. What about glycerin suppositories? Can be used safely. However, this is not related to the meal. This is added by mistake. Lactulose is a group B, which is osmotic laxative, can be used safely in pregnancy. I used to give lactulose at night, HS. You can start by 5 ml or 7.5 ml at night. What about the anorectal preparation, antihemorrhoidal cream or antihemorrhoidal suppositories? Both are group B, so can be used in pregnant women. So these are the medication for the GIT, which is available in primary healthcare and its categories. Now I will speak a little bit about the management of common gastrointestinal disease during pregnancy, which are commonly is nausea, vomiting, and heartburn, diarrhea, and constipation. So as you know here, for the nausea and vomiting, always you have to take full history and examination and investigation. I'm sure you all taking this history, whether the nausea and vomiting associated with abdominal pain, any urinary symptom to rule out urinary tract infection, any history of Helicobacter bacteria infection. Examination, of course, you will take the temperature, the pulse rate, blood pressure, and the respiratory rate. You will see if there's any abdominal tenderness. And the sign of dehydration is the most important. And also it's very important to ask history, how many times she is vomited, and the color of the urine. Investigation, of course, you will ask about, the most important is urine routine in order to rule out urinary tract infection, and also to see whether there is urine ketone or not, in order to assess the dehydration situation of the pregnant woman. So if you find urine ketone 2+, you can proceed and do CBC to rule out any infection. And always, if there is dehydration, there will be increased hematocrit. Also, you will do electrolyte to see if there is hypokalemia. And also you will do blood glucose. It's very important to know this urine ketone, whether it's related to the dehydration or due to diabetic ketoacidosis. Regarding the ultrasound, you just can have an idea whether it's single or twin, because everyone knows that nausea and vomiting increased in pregnant women with twins or with the hydatiform mole. Sometimes we will do also liver function test, renal function test, amylase to rule out pancreatitis, LFTE to rule out hepatitis or liver problem, and sometimes thyroid function test for hypo or hyperthyroidism. So this is common knowledge. I'm sure all of you are doing this. So what are the safest medication in nausea and vomiting? This is from RCOG, Royal College of Obstetrics and Gynecology: cyclizine, prochlorobenzene, promethazine, chloromazine. Chloropromazine, as you find, this is the first line of treatment and can be used safely in pregnant women. The second line is metoclopramide, which is known as primipram. We have it here in our polyclinic. Domperidone, also we have it. Ondansetron, it is not available, but also the safe. Even corticosteroid, many are asking about corticosteroid, whether it is safe to be used in pregnant women or not. As you find here, according to Royal College of Obstetrics and Gynecology, it is safe. But of course, we will use the first line. If it's not available, we'll use the second line. So here, this is the safe medication and the doses. Just please regarding the metoclopramide, because most of us using metoclopramide, you can use 10 milligram TID oral tablet, but please maximum is 5-day duration, not more. Okay, and domperidone also can be used as a second line. Promethazine, we have it also, can be used at first line. So there's no problem if you use metoclopramide or promethazine. B6 also can be used. It's not mentioned here, but it's also safe and can be used for nausea and vomiting in pregnant women. So again, we have this chart, which is very important for mild nausea and vomiting. If the urine ketone, of course, as we say, we will take full history and examination, and we'll send urine routine, including the urine ketone. If nil, just will advise her to increase fluid, oral fluid, and small frequent meals. Avoid spicy and fatty food, and we can give oral antiemetic. You can give whatever you want according to the previous chart. If you find 1 to 2, it also can be treated in outpatient in our polyclinic. You can give 1 liter normal saline or Ringer lactate. Please avoid glucose water. Do not give glucose water in nausea and vomiting, especially if there's urine ketone positive. Here they are added 20 millimole potassium. However, I not recommend to give this because most of the women dehydration can be corrected by 1 liter normal saline. You can repeat the urine ketone after every 1 liter, or even you can give 2 liter, no problem. And it will be advise the women to increase fluid intake. I always used to tell the patient to drink Pocari, sweet or yogurt, not necessary water. And of course, you can give IV antiemetic, metoclopramide, whatever you have in your polyclinic, according to this chart. So you can give metoclopramide or you can give promethazine according what you want to give, but both are safe. If severe dehydration 3 or 4 and you find the patient is tired, of course, you will give her IV fluid, 1 liter normal saline, and you will collect the blood for CBC, liver function test, renal function test, and electrolyte. If there is hypokalemia, is up to you. You can give, start it with a 20 millimole potassium over 2 hours. However, in our polyclinic, we give normal saline 1 liter and repeat it again. If you find it's, for example, it was a 3 and become 2, it become 2, so that's mean give her another 1 liter and advise her for fluid intake. But if you give her 1 liter and persisted 3 or more, become more 4, it's better to refer her to a secondary hospital, because maybe need for inpatient admission. And regarding the low molecular weight heparin, it is not for primary healthcare, it's only for secondary healthcare. For example, in our Masana Polyclinic, we refer to Rustaq. But many of our patients are response to fluid, so we just give a fluid, and after that we assist the patient. But if the patient couldn't tolerate any oral food or any oral fluid, liquid, so it's better to refer to the hospital for safe confinement. What about constipation in a pregnancy? Everyone knows that constipation increasing in pregnancy due to hormone progesterone, which lead to reduce the gut motility, and also due to increased aldosterone in a pregnancy, which lead to increased absorption of fluid from the intestine. So always we will advise the women here for diet modification, increase fiber in diet. And also we can give laxative, but we must take care these laxatives not effect on the baby, means not teratogenic and not excreted in breast milk. And also we can we must put in mind, please, as we say in the first few slides, antispasmodic like hyoscine, which is the same as Buscopan, and anticholinergic like mifeprine, please to be avoided in pregnancy and should not be used. This is according to the last update of Gynae. So again here for constipation, this is very nice diagram. Always ask the women to increase fiber in diet, increase fluid intake, and also advise her for moderate exercise, because sedentary life increase risk of constipation. If there is no response to no response to diet, of course we'll start for her medication. If there's no response to one therapy, we can use combination. As you see here, no response to one therapy, then a combination of medication from the different group can be used. So I can use, for example, fibogel with laxative if there's no response. But first, I must start with fibogel. Fibogel is available in our polyclinic, and it's considered the first management for constipation. Contraindication if there is fecal impaction. And please counsel the patient that it's need few days to work. So I will tell her it's not from first day you will take this fibogel and you will improve. No, we'll tell her this medication might need a few days in order to work. The second line is osmotic laxative, which is lactulose. Again, lactulose, please do not use in two condition. As from its name, lactulose, will not give it for a diabetic, and if there's electrolyte imbalance. And as you know, sometimes lactulose lead to feeling the mother will feel like abdominal bloating. So if she has lactose deficiency, also it's better to be avoided. So lactulose avoided in diabetic women, and if there is electrolyte imbalance. Many are asking about Buscopan, whether it is safe or not. Buscopan can be used in a pregnancy, has no teratogenic effect. However, it's preferred to be used in caution in third trimester because sometimes it leads to contraction, uterine contraction. However, it is not contraindicated. What about the Becina? Becina is also a stimulant laxative, but here it is better to be avoided in breastfeeding, but can be used in pregnant women, but avoided in breastfeeding. What about suppositories, glycerol suppositories? After fail of all this medication, we can use suppositories is group B, no contraindicated. But of course, we start fibogel, lactulose, Buscopan, then the suppositories. What about diarrhea? So most of you know that diarrhea mostly are viral. So of course you will take history, whether she ate it from outside, whether there's similar history in her family. Please ask if there is blood or mucus, because this is red flag. As you know, maybe this is amoebiasis. If it is more than 2 days, if there is fever, if there's severe pain, if there's severe dehydration, these are the red flag. But in general, we will advise the women for diet modification and use bland foods. What are the bland foods? Include banana and plain potatoes, rice, toast, crackers. So we'll advise these foods in order, because as you know, banana and plain potato has potassium, so can replace some electrolyte, because diarrhea also lead to a loss of electrolytes. Also increase fluid intake, and we can use antidiarrheal medication For example, loperamide, it is, as we say, it is group B, safe in pregnancy. Now, this is also a common symptom. Gastro is a visual reflex, and most the women, they complain of heartburn. Sometimes they come as they have MI, chest pain, but of course, if you give them some Moxil, ranitidine, omeprazole, they will improve, because this is due to acid reflux, and it's mostly increased 51% in the third trimester because of the enlarged uterus that pressed on the stomach. So here, always we'll start with lifestyle modification by small meal, head of the bed elevation, do not eat anti-sleep, avoidance of postprandial recumbency, and also should avoid the fatty foods, tomato paste foods, coffee, spicy food, and oral anti-acid. As we say, Moxil is safe. If no response, you can give famotidine. If no response, you can give omeprazole. So these are the references. You can, if you like to read more about it. And if you have any question, please, you can write it in the Facebook, and anyone attend or will listen to this recording and want to get certificate, please write full name and their email, so we will forward their certificate to their email. Thank you very much for your listening. Thank you.